Hi all, welcome back to our osteology series. Today we are going to discuss about norma basalis.
Norma basalis is when skull is viewed from inferior aspect. For the sake of convenience of study, norma basalis is divided into three regions: anterior, middle, posterior, by two imaginary transverse lines. Anterior transverse line passes along posterior free margin of hard palate, and posterior transverse line passes along anterior margin of foramen magnum. Anterior region of norma basalis presents two main features: alveolar arch and hard palate. Alveolar arch is U-shaped ridge of bone formed by alveolar process of two maxillae. Hard palate is formed by two pairs of bony process, anterior 2/3 by palatine process of maxilla and posterior 1/3 by horizontal plates of palatine bones. Other features include incisive foramen, through which nasopalatine nerve and sphenopalatine vessels passes, greater palatine foramen through which greater palatine vessel passes, and lesser palatine foramen through which lesser palatine vessel passes. Middle part of norma basalis. It extends from posterior margin of hard palate to an imaginary transverse line that crosses anterior margin of foramen magnum. It consists of a median area and lateral area. Median area presents posterior border of vomer which separates two posterior nasal apertures, and broad bar of bone that is formed by fusion of body of sphenoid and basilar part of occipital bone. It presents pharyngeal tubercle a little in front of foramen magnum. The lateral area is formed by pterygoid process of sphenoid bone, greater wing of sphenoid bone, and petrous part of temporal bone. Pterygoid process of sphenoid bone presents pterygoid humulus, scaphoid fossa. Greater wing of sphenoid bone presents spinosphenoid, foramen spinosum, foramen ovale, foramen lacerum, and sulcus tubae. Foramen spinosum lodges middle meningeal artery, nervus spinosus. Foramen ovale consists of mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein, which is easily remembered through a mnemonic male. Foramen lacerum, through which meningeal branch of ascending pharyngeal artery passes, emissary vein, internal carotid artery, and sympathetic plexus around it, and greater petrosal nerve. It also consists of sulcus tubae, which is a group between posterolateral margin of greater wing of sphenoid and petrous temporal bone. Petrous temporal bone consists of apex, which is perforated by carotid canal, which consists of internal carotid artery. Posterior part lies behind imaginary transverse line passing along anterior margin of foramen magnum. It presents a median area and lateral area. The median area consists of foramen magnum, external occipital crest, and external occipital protuberance. Lateral area consists of occipital condyles that articulates with atlas, condylar fossa that lodges emissary vein and meningeal branch of occipital artery, hypoglossal canal that lodges hypoglossal nerve, meningeal branch of ascending pharyngeal artery, jugular foramen, which consists of three parts: anterior, middle, and posterior part. Anterior part lodges inferior petrosal sinus. Middle part consists of 9, 10, and 11th cranial nerve, and posterior part sigmoid sinus, which is continuous as internal jugular vein, hence the name jugular foramen. And then we have carotid canal, which lodges internal carotid artery and carotid autonomic plexus. And then we have a stylomastoid foramen, through which facial nerve passes. So the foramens of norma basalis are incisive foramen, greater palatine foramen, lesser palatine foramen, foramen spinosum, foramen ovale, foramen lacerum, condylar foramen, hypoglossal foramen, jugular foramen, carotid canal, and stylomastoid foramen. That's all. Thank you.